A plan to let parents use public funds to pay for private schools clears a key hurdle at the Capitol.
We will lead in Texas to create and produce a model today that will be a model for the nation.
But the biggest challenge is yet to come. We go in depth with the bill's author for insight. A new push to ban COVID vaccine mandates, how this proposal goes farther than previous bans, and why it has people worried about the health of Texans.
It's very easy to say, I reject Hitler sympathizers, I reject an individual who denies the Holocaust.
A quarrel over donations from a powerful political PAC, how a controversial meeting is fueling tensions between two of the state's top leaders.
Produced from the Capitol in Austin and airing statewide, this is the award-winning State of Texas.
Hello and thank you for joining us. I'm Josh Hinkle. Texas senators pushed Governor Abbott's plan for private education subsidies closer to the goal line. His plan for education savings accounts, or ESAs, would give families $8,000 to move their child out of public school. The plan won Senate approval, but the governor has been at odds with some Republicans in the Texas House who say the plan would hurt their school districts. As Ryan Chandler shows us, neither side is backing down.
I will not stop until we get ESAs passed in the state of Texas.
Governor Abbott adamant his final push for ESAs will be victorious.
We are on the 1 yard line.
18 ayes, 13 nays. Senate Bill 1, school choice, has passed.
Moments after midnight Thursday, the Texas Senate passed a $500 million bill to establish an ESA program after hours of debate. But some fellow Republicans in the House stand in the way.
To me, this debate is about, are we going to fund public schools at a proper level to allow chance of success for our students?
The governor now making clear he will only support more public school funding and pay raises for teachers if the House gets on board with ESAs.
I wrote the agenda for the special session as only addressing ESAs. Once ESAs are passed, I will put on the legislative call the full funding for public education, including teacher pay raises.
Republican opponents are entrenched, promising to draw out this fight as long as it lasts.
If I'm here in November, December, January, February, March, I'll be here. I mean, this is one of those things that I feel passionate about, and we're not just going to shrink from the responsibility.
Nothing's changing.
Nothing changes.
Ryan Chandler, State of Texas.
We want to go more in depth. Capitol correspondent Monica Madden spoke one-on-one with State Senator Brandon Creighton. He's the author of Senate Bill 1. He gave us insight into the challenge of passing the legislation and why he says, don't call it a voucher bill.
We know that it has been more difficult in terms of passing the education savings account on the House side. If the House doesn't take up Senate Bill 1, which is the school choice school voucher bill, would the Senate use Senate Bill 2 as a vehicle, the education omnibus bill funding one? Would they use that as a vehicle to try to get the House to pass Senate Bill 1?
Well, we're working more optimistic on, our goals for, not only passing school choice, but the assumptions are that the House will be working on their measure and what they would like to see come together for the subject regarding school choice and education freedom, and we're doing the same. If we get into a tough situation at the end of the 30-day regular session where for some reason a bill has not moved, then we'll have to make decisions. But right now our intent is to keep these subjects separate.
And it can't be one without the other in the mind of lawmakers because the ESAs was the governor's priority, right? Is that what your thinking is?
Yes, the education savings account, that is an emergency item for Texas as established by the governor. Because that is not yet finished and accomplished, we're back again after the tax specials to address this issue along with school funding, along with teacher pay, and all of the historic new funds that we're putting into public schools.
Do you feel confident, even though it wasn't on his list, that the governor would approve a school funding teacher pay raises bill as proposed by the Senate and hopefully agreed upon by the House?
I think all of these issues are very important. You know, public schools have passed budgets, and they're expecting for the school funding bill to pass and for us to take care of that part of what they base their budgeting off of for the year. So I would expect that we would accomplish all three. Of course, we have to base our sequencing and our goals on what's established as an emergency item. So I would expect school choice would be the top priority until we get that accomplished and set aside.
You have been hesitant and made a point during the Senate Education Committee to avoid the word vouchers and make a clear distinction between that. Republicans have definitely, I think, avoided the word vouchers in general. So what exactly is the difference between an education savings account plan and a school voucher?
Yes, in describing the difference between voucher and education savings account, I'm not as much doing that for political reasons. I'm making sure that the public that's watching that may have specific concerns about dollars transferring directly to a family where it could be misused or not spent wisely or not spent on the appropriate education materials. That's not what we're doing here. That's a voucher. What we're doing here is working towards an education savings account where the comptroller's office, not the Texas Education Agency, would build a framework, would manage these accounts. There are specific and rigid audit provisions. Again, it's an education savings account, so the account and the $8,000 that's approved for the limited number of students in Texas that would even be able to use one of these, those funds would distribute to an approved and accredited private school instead of being distributed direct to the family for them to make decisions on how they want to spend the money.
Let's talk about cost. This is going to cost the state about $500 million for each 2-year cycle. Right. Do you see that as something that will be sustainable coming out of what we had as a record budget surplus year in the years to come for Texas?
I do, and that's why we have the program exactly where it is, with $500 million dedicated, completely separate from public school funding. We have historic funds going in to public schools, not only matching the last 2-year budget for public schools, but the new money going into public schools is approaching $9 billion, which is the entire state budget for 11 states in America. Not just the new money, not the entire budget for education, but just the new dollars that we're dedicating. So we have a tremendous lift for public schools and public school teachers. This $500 million, like the border, like the grid, healthcare, CPS, highways, transportation, water, it's a separate funding initiative that does not go through the Texas Education Agency.
All right, Senator Brandon Creighton, Thank you so much for joining us.
Thank you.
Monica spoke at length with Senator Creighton. He gave us deeper insight into several aspects of the education legislation, as well as his insight into the effect tensions between House Speaker Dade Phelan and Lieutenant Governor Dan Patrick could have on the bill. We posted the full interview online, and you can find it in this week's State of Texas story in the Texas Politics section of our website. Tensions rise between two of the state's top leaders. This time it's a quarrel over donations from a powerful political PAC.
They are funding the type of Republicans that are unacceptable at the ballot box, and they keep losing at the ballot box.
How a report of one group's meeting with a Hitler sympathizer is fueling the feud between the speaker and the lieutenant governor. A new push to keep healthcare workers from being required to get the COVID vaccine. How Texas lawmakers are responding to the legislation. Tensions between two of the state's top leaders hit a new high this week. House Speaker Dade Phelan called on Lieutenant Governor Dan Patrick to give back donations from a powerful political group linked to a white supremacist. That led Patrick to call for Phelan to resign. The tension started after the Texas Tribune reported leaders of the Defend Texas Liberty PAC met last weekend with white supremacist Nick Fuentes. He's a far-right commentator who has praised Adolf Hitler and denies the Holocaust happened. The PAC issued a statement condemning Fuentes' views, but news of the meeting led Phelan to call on Republicans who took donations from Defend Texas Liberty to return the money. Patrick accepted a $3 million donation from the PAC earlier this summer. He condemned the meeting, releasing a statement saying, "Nick Fuentes and his anti-Semitic rhetoric have no place in the United States. Those who spew such vile, loathsome abominations will have to answer for it." But Patrick also condemned Phelan, writing, "For anyone to try to use these invectives for their own political gain is below contempt." Patrick also said he would not return donations from Defend Texas Liberty. Phelan said it's wrong to keep funds from a group that met with Fuentes.
It's very easy to say, I reject Hitler sympathizers. I reject an individual who denies the Holocaust and someone who supports, Aryan Brotherhood. It should be easy for Republicans to do that, and I've yet to see some of these individuals do that. And that's on them. It's not me. I haven't taken a dime from these people, and I never will. Of course, Lieutenant Governor and others have condemned him and said that what he said is totally incorrect and irresponsible and distanced themselves from him. But that didn't change the fact that he is now associated with a political action committee that is at the heart and soul of this civil war in the Republican Party. They are funding the type of Republicans that are unacceptable at the ballot box, and they keep losing at the ballot box.
Some Republicans did return donations, including conservative Jared Patterson of Frisco. Patrick said he decided to keep the funds after speaking with billionaire Tim Dunn, who provides much of the funding for Defend Texas Liberty. Patrick said Dunn condemned the meeting with Fuentes and called it a serious blunder. Patrick said Dunn assured him the PAC would not have further contact with Fuentes.
This bill's about protecting individuals.
Discussion in a special session over a new law to ban COVID vaccine mandates. How this law goes farther than previous bans and why it has people worried about the health of Texans. A new state law aims to help you know what you pay for medical treatment. Our investigators take a closer look at what itemized medical receipts mean for patients and how the law is already making a difference. Lawmakers are making progress on another one of Governor Greg Abbott's priority items in this special legislative session. On Thursday, the Senate approved a plan that would expand a ban on COVID-19 vaccine mandates. Digital anchor Will Dupree joins us to walk us through what this proposal would do and who would be affected. Will, thanks for being here.
Nice to be here with you.
Well, let's get started by discussing what the governor asked lawmakers to pass.
Governor Abbott would like them to ban all private employers here in Texas from requiring their workers to get the COVID shot. This would go farther than what the legislature did earlier this year during the regular session. They approved a ban initially on governmental entities like the state itself or a school district from implementing a COVID vaccine mandate. So this effort would do more than that.
Well, tell us about the bill that the Senate did pass.
The Senate voted along party lines and approved Senate Bill 7. State Senator Mays Middleton, a Republican from Galveston, introduced this legislation and says it's needed to protect people's own medical decisions. And here's what that bill would do exactly. It would bar an employer from requiring the COVID shot in order for someone to keep their job, apply for one, or secure a contract. The bill would also prohibit employers from taking an adverse action against someone who does not want to get this shot. Hospitals and healthcare facilities, though, would not be faulted if they put in place reasonable rules that an unvaccinated worker would have to wear certain protective equipment to do their jobs. Additionally, the bill would allow people to file a complaint with the state to investigate any alleged retaliation, and employers could face a fine of up to $10,000 for each violation. Now, earlier this week during a committee hearing, Democratic Senator Boris Miles of Houston questioned the bill's author about why the proposal had no exceptions for healthcare facilities. That means doctors, nurses, and other healthcare workers who care for patients would not be required to get the COVID vaccine. Let's take a listen.
Don't you think we should allow businesses and providers that work with our most vulnerable population to create policies that protect those people?
This bill's about protecting individuals. And this protects individuals from losing their job if they don't believe the COVID vaccine is right for them for whatever reason.
Now, well, one thing that stood out listening to this hearing was the level of concern lawmakers had over the vaccine. That might surprise some people. What did you think?
Republican senators in particular talked a lot about the harm that they believe this vaccine causes people. Now, many doctors and a lot of the leading medical organizations would wholeheartedly disagree with some of their claims, but State Senator Lois Kolkhorst, who chairs the committee that considered this bill initially, said that there is a heightened skepticism of science in general since the pandemic began and the development and rollout of this vaccine. In debates later, State Senator Brian Birdwell brought up the fact that a lot of people have concerns and questions about the efficacy of this vaccine. Now, what he said is that, there may be additional research or data that comes out and changes people's minds. So he suggested a sunset clause to this bill that would require lawmakers to revisit this ban at some point in the future. However, that language did not end up in the final version of the bill that the Senate passed, and that argument just simply did not win out.
What does happen next?
The Texas House of Representatives will take up this bill. It's unclear when the state reps will consider this bill. However, they will have to approve it first before it can then go to the governor's desk for his signature and possibly become state law.
All right. Well, thank you very much.
I would like to know what I'm being charged for. And people make mistakes. Things happen.
A new state law just took effect to help you get itemized receipts when you get medical treatment. How the law is already helping patients. Hospitals and other health providers in Texas are now required to provide patients with an itemized invoice so they know exactly what they're paying for after treatment. The new state law comes after our investigation focused on Central Texas medical debt lawsuits. Many patients told us they could not get details on what they owed. As investigator Arzo Dost explains, the law went into effect in September and it's already making a difference when it comes to transparency.
0 days, SB 490 is finally passed.
Legislation pushing more transparent medical billing is headed to the governor.
So at the end of the day, a great bill that's going to help every Texan.
As Senate Bill 490 became law, we tracked every step.
I was getting email alerts and I started to follow each stage.
So did Michelle Ledesma from Cedar Park. She was hospitalized for a severe bacterial infection in 2018.
I was sued for a bill that I received from a hospital, and I kept asking for the itemized statement. I never received it.
Now, hospitals and other healthcare facilities, including freestanding ERs, birthing centers, and drug treatment facilities, are required to give patients a written itemized bill before sending it to collections or trying to collect any money owed. The law says the itemized bill has to be in terms the patient understands and include medical codes and prices. It can also be issued electronically through a patient portal.
This was our crowning achievement. This is what we set out to accomplish day one. This was our priority for session.
State Representative Caroline Harris and Senator Brian Hughes worked together to pass the legislation last regular session.
How will you monitor that the law does what it's supposed to?
My team and I are already kind of getting ready to make sure that those hospitals and medical facilities are in compliance with it, and we're also ready to just figure out, hey, if they're not in compliance, why? How can we help? Is there some issue with the language that we need to clear up?
The Texas Health and Human Services Commission will oversee the rollout of the law and compliance. The agency just published this guidance letter, which outlines provider responsibilities and expectations. HHSC is also primarily responsible for taking disciplinary action against providers in violation. In an email, a spokesperson says enforcement could include denying, suspending, or revoking a license, and administrative penalties ranging from $1,000 to $25,000 for each day in violation.
The other piece of this is that the courts can be involved as well. So a lot of these cases have gone to court where a hospital has sued somebody for not paying a medical bill. And so those judges and justices have the opportunity to say, okay, well, I know now that the hospital has to provide an itemized bill. Did you do that? Where's the proof of that? So that we can see if this charge is actually accurate or not.
The law is not retroactive, so it doesn't apply to cases before September 1st, like Ledesma's.
I would like to know what I'm being charged for, and people make mistakes. Things happen. And I think this right here will help prevent some of that.
Ledesma says she eventually got an itemized bill in court and found discrepancies. She shared her story with lawmakers during the session, hoping to make a difference. She thinks the new law's already having an impact.
When I have gone to an emergency room or to a recent doctor, different type of procedure, I've asked for the itemized statement, and I've noticed I'm getting it faster. And that's a good plus for us because we're able to see it sooner.
Arzo Dost for State of Texas.
The Texas Hospital Association, which opposed the legislation because of costs it anticipated, says it's been working to make sure hospitals know about the law and has been offering guidance so they're ready. As Arzo mentioned, we followed this legislation very closely to catch up on how we got here and how you can file a complaint if a provider is not in compliance. Click on this story in the Texas Politics section of our website. Thank you again for joining us for State of Texas. I'm Josh Hinkle, and we'll be back next week to bring you an in-depth look at Texas politics.